Now, for today's studio demonstration, if you're embarrassed by the colour of your teeth, then stick with us, because we're going to show you how to get a whiter smile in an hour with Harley Street dentist Dr. Tariq Idris. Welcome to the show, Tariq.
Thank you. Good morning.
Now, we had you in a little bit earlier on, didn't we, to do a demonstration. James, who works here, 33-year-old James, self-confessed chain smoker. He's getting married in a few weeks, and he was desperate for a smarter smile. So what did you do for him, Tariq?
We carried out a procedure called power whitening, and this is a 1-hour process where you literally end up with whiter teeth, without drilling, without injections.
OK, so let's look at the stages involved. Step one?
Well, step one, we first of all protect the gums. So we paint a protective agent over the gums, and that gets hardened over with a light. Right,
so the gel you're putting on here is literally just to stop the bleaching agent going onto the bits where you don't want it to go.
Absolutely. I mean, we don't want the gums to go whiter. That isn't really an in vogue look.
No.
So, yeah, it's just a barrier. As you can see, we've then apply the whitening gel to the teeth. It's all very, very gentle, very sort of non-invasive. We simply paint the whitening gel onto the teeth. This has got the peroxide in it, which then is activated by the whitening light, as you can see that being applied now. And
we said, you know, a whiter smile in an hour. The whole process takes an hour.
Just an hour and 10 minutes or so. Yeah.
Right. Well, let's have a look at, before you started all of that, you actually did a sort of a proper objective measure of how white James's teeth were, or how stained they were. Let's have a little look at that and see what he looked like before. So here we are. Yeah,
James has been smoking for a while, so he was. They were a little discoloured. He was about the middle of the chart of from darkest to lightest.
And here he is afterwards. A noticeable difference.
Yeah, he went right up to the top of the scale. So you know, we're delighted with the results, and all bodes well for James's wedding.
Well, more importantly, James is in the audience. Now, give us a flashing smile, James. Is that the best you can do? Well, what do you think, James? What was it like having it done?
It's great. It's quite relaxing, actually. Not painful at all.
And what do you think of the end result?
I'm really pleased, actually.
And your fiancée doesn't know you've had it done?
Yeah, it was a birthday last night, so it's a birthday smile for her.
Well, let's hope she likes it. Just got to shave the beard off now. No, it's OK.
Well, I think he has promised to give up smoking as well, so that would be really important.
Well, that was my first question to you. How long does this procedure last? I mean, if James goes back to smoking, his teeth are going to get stained again.
They will do over time. The procedure will keep the teeth whiter for probably 2 to 4 years, depending on how you look after them. So if he's chain smoking, he's going to stain them up pretty quickly.
There's something about putting bleach on teeth that makes me feel slightly uncomfortable. You know, we have the enamel, the outer protective layer of our teeth. We worry about acids and sugars and things dissolving and damaging that. Are we doing some sort of permanent damage to the teeth?
Well, let me make something really clear. This is not bleach.
Right.
The word bleaching your teeth, the phrase is used. This is not bleach, it's peroxide. And actually,
but peroxide is a type of bleach, though, isn't it?
Well, technically, you know, bleach is hypochlorite, isn't it? So this basically, all this does is break down to release oxygen. The good news is it's been around for decades. And it was originally used to actually help improve the health of gums. So they would apply it to improve the health of the gums, and they found, oh, the teeth have gone whiter as well. So it's been around for a long, long time. The good news is it's simply breaking down to release oxygen. The oxygen whitens the tooth, so it doesn't damage the teeth at all.
So as far as we know, there's no long-term consequences. And you can repeat this treatment?
You can do. After a number of years, you can have it topped up, absolutely.
Angela, what about this quest for the whiter smile?
Well, it's no different to the quest for eternal beauty and youth. And I think, you know, we know psychologically that if somebody has a smile, you look from the eyes to the mouth, you know, we're immediately finding them more attractive. But I think the whole kind of bleaching thing has come from the world of celebrity. It's become much more accessible, and more people are chasing after that kind of toilet bowl smile.
Well, the super white. I mean, I think, James, there was an improvement there. I can see that an over-white, sort of artificial smile is a potential problem, don't you think?
I think so.
I mean, do people come in saying, I want white, I want to go right off the top of the scale?
Yeah, we do get people saying that they'd like that, and I quickly reach for the Tipex. But I mean, typically the British public want a brighter smile, but not the Hollywood white that the Americans go for.
OK, let's have a look at. I mean, obviously the key to looking after teeth is not to get them stained in the first place. What are the major culprits that would affect your?
Well, obviously we said smoking, things like red wine. curries, foods with, you know, a lot of colouring in them.
Dyed.
Yeah, tea and coffee, of course.
Of course, and some people are born with slightly different coloured teeth, aren't
Absolutely.
they? So some people, I mean, look at that sketch. You have perfectly clean teeth, but still have slightly yellow teeth.
Yes.
What about home bleaching kits? We've got an example here, but there are a number of them available, particularly on the internet. You can get these, you know, like a gum shield that you fill.
Sure.
What's your thought on that?
Well, the profession is a little bit concerned about some of them. I mean, you have simple things like whitening toothpastes, which you can buy. Now,
Which are basically just a better detergent, aren't they?
They won't whiten your teeth.
Yeah.
They will remove some of the stain, which in itself is useful, but they won't whiten your teeth. Now, some of the actual home bleaching kits, we're concerned because if the tray doesn't fit terribly well, then are you ending up swallowing some of this stuff? And also, a lot of the ones that we can buy don't tend to have a very strong agent in them, and so the result won't be as noticeable.
But there isn't any evidence that that people are causing themselves harm in terms of damaging the teeth.
I think there has been, you know, some studies that have shown that, you know, people can end up ingesting some of this stuff, and some of the agents are damaging to teeth.
What about the products that are gritty? They have a sort of, you know, like the smoker's polish. You often see this powder you put your toothbrush in, and that's quite abrasive.
Absolutely. And if you're using those abrasive pastes, you will wear away some of the enamel, and you could cause some damage if you use them in a very harsh fashion, if you use them too regularly.
And roughly, how much would people expect to pay to have a professional tooth whitening procedure like the one we've just seen?
Well, the power whitening, typical ballpark figure is about £600.
OK, so your top tips for maintaining a white, nice, smart smile are?
OK, well, my tips would be, number one, I hate to sound like matron, but brush and floss your teeth at least twice a day. Brushing is important, but the flossing will get to the areas such as in between the teeth, which you can't get to. Use a whitening toothpaste to break down the stains that we all build up. It's all very well saying don't smoke, don't drink tea and coffee. Who wants to follow that advice? The important thing is to use a whitening toothpaste to help break down some of the stain. Control your sugar level. Now, what's important here is not to have too much frequency of sugar. So don't have too many cups of coffee with sugar or tea with sugar. And it's not just the chocolates, you've got to watch the drinks as well. It is important to see a professional. Visit your dentist and get their advice and make sure everything is healthy. And one of the best ways to keep teeth looking good is to have them polished with a hygienist.